So the REDUCE LAP studies are a sequence of trials in the heart failure with preserved or mid-range EF population. And this is a group of patients for whom we all appreciate there is really no effective therapy. So these trials have been done to test the concept of an InterAtrial shunt device, or IASD, to allow pressure decompression of the left atrium into the right atrium, especially during exercise. The device is similar to an atrial septal defect occluder, except that it has an 8-millimeter hole in the center. And the implant is done via venous access and a transeptal puncture. The device itself is very simple. The concept is very clearly that we have shown in many trials that elevated wedge pressure is the driver of symptoms and probably of late poor prognosis in these HFpEF patients. So we have studied this device in 2 open-label, non-randomized groups, an 11-patient pilot study and a 64-patient registry. The trial we're presenting here at the European Society of Cardiology meeting is a 44-patient, 22 in each group, randomized trial to assess the hemodynamic effects of this device and really demonstrate clearly that it does decrease wedge pressure with exercise. So these 44 patients were randomized 2-to-1. They all got a procedure, so half the patients got a device, half got a sham procedure, and we looked at exercise wedge pressures at baseline and 1 month. And we've previously reported the 1-month outcome, very clear decrease in exercise wedge pressure with the device, and of course no such improvement in the sham patients. At this meeting, we're reporting 1-year secondary, but 1-year unpowered clinical endpoints. And these include New York Heart Association class, Kansas City Quality of Life questionnaire, 6-minute walk test. And what we see in all of those, even in this very small, not powered group, are trends in the right direction. When we look at the 100 patients total now, these 3 experiences that we've treated with this device, we see several big messages. One is tremendous safety, no important major adverse events in the device group, and certainly no unexpected events. And we see these very clear trends toward clinical improvements. In the non-randomized group, we have demonstrated 1-year meaningful, statistically important quality of life improvements. So we are at the point where we see a clear database, establishment of more than a signal that this may be an effective therapy for HFpEF. And our next step is a 600-patient randomized pivotal trial, which is ongoing. So we will have, I think, very clear answers to, is this going to be a real therapy for this underserved, very needy population?